SS-31 in kidneys. So this is really important. In this video, I'm going to talk to you about some of the new research, the data on this very new FDA-approved peptide that's only 4 amino acid chains. Is one of the smallest molecules in the peptide world ever to be approved by the FDA, and for good reason. And I'll talk to you about what it does. So this peptide was discovered out of University of Pennsylvania in the early 2000s. And one of the things they looked at are what are the ways that it can help protect the mitochondria. And so in this video, I'll be uncovering some of the cool pathways that it works on, how your poor energy may not be from dehydration, it may not be from stress, it might actually be from a cell danger response that's triggered from the mitochondria. So I'm Regan Archibald, founder of Ageless Future. We have a physician-led peptide program that you can access by going to agelessfuture.com, where you can work with the talented medical team at Ageless Future. They'll get the right testing ran for you and determine if SS-31 or other amazing peptides might be right for you. So this peptide, SS-31, how does it work on kidneys? So kidney health are really important in Eastern medicine, specifically TCM. When I studied that, they looked at the kidneys as being the house for the reservoir of your longevity. So the kidneys are an underappreciated organ. And if any of you have ever had like treatment-resistant hypertension, your kidney energy just gets zapped. And once the kidney energy goes and you lose that filtration, once you're on dialysis, there's really no turning back. And so in looking at SS-31, one of the powerful things it does is it can help regenerate the kidneys by working through the mitochondria. Now, this is interesting because one of the studies that they did, this was done at the Mayo Clinic in Rochester, Minnesota. And these are patients who had the atherosclerotic renal artery stenosis, and they were undergoing renal angioplasty. It was a small study, just 14 patients, 8 were on placebo, 6 were on SS-31, but it was peer-reviewed. And what they wanted to find out, they wanted to understand if SS-31 had any protection against the procedure-induced kidney hypoxia, inflammation, and functional decline. And that was the big thing. And so what they did is they did SS-31 infusions intravenously, and they used 0.5 milligram per kilogram in the IV. So if they're 100 kilograms, they're using 50 milligrams of SS-31. And what they did is they followed the placebo group post-procedure, and then they followed the group that got the SS-31, the control group. And what they found is that the SS-31 infusion reduced the post-PTRA, the renal hypoxia. It increased renal blood flow and cortical perfusion at 3 months, lowered systolic blood pressure, and improved estimated GFR and serum creatinine, demonstrating kidney protection via mitochondrial stability in proximal tubules and nephrons during ischemic stress. So I know that was a lot of jargon, but at the end result, they found that this little tiny 4 amino acid chains, it almost performing like a bioregulator, just went in there and it repaired these tubules in the kidneys and the filtration systems so that there wasn't this death to the tissue or ischemic event. And that was really exciting. So looking into this deeper, how does this actually work? Well, 4 amino acids, it's a tetrapeptide. And the size doesn't mean it's going to be more powerful. Usually the larger the peptide, the riskier it can become. And this is one reason why certain peptides like cerebrolysin have been classified as a biologic by the FDA. The other reason is biologics, you can have a 12-year patent instead of a 5-year patent on a peptide. There's other incentives, there's reasons why they want that, the pharmaceutical companies want the list shorter. But this was discovered by Dr. Cizzetto in University of Pennsylvania. And what she found is that SS-31, also known as MTP-131, it did increase mitochondrial function in people who had Barth syndrome. And what you're doing is they found that the mitochondria starts to break down, and they found that these individuals had poor recovery, poor performance in exercise. They had lower cognitive scores. They had very poor ability to recover from almost anything. Now, when she started diving it deeper, they're looking at this little molecule for kidney function. And what they found is that the kidneys, at least in the rodent models, when they would have an acute injury to the kidneys, and they would do SS-31, it was like a reboot for the system. These mice would have better glomerular filtration, they would have creatinine levels that would start to stabilize, and they also found these mice had far more energy. So if you're somebody who is looking at your kidneys may not be functioning properly for one reason or the other, I've not seen anything where it lowers blood pressure or stabilizes blood sugar, but those are two pathways that you want to look at. And the other thing that SS-31 probably is not going to do for those of you performance junkies who want to just look and feel your best, you're already fit and you want to just get some leverage, SS-31 can give you that little extra boost when it comes to mitochondrial energy. The thing it won't do is if you have a sedentary lifestyle, you're stuck on the couch, that kind of diet and lifestyle is not going to influence the mitochondria in the same way. The thing that SS-31 does is it's a bodyguard for the kidneys. It protects the nephrons. These nephrons are the microscopic workers that help with the filtration system. When the body stops making SS-31, the kidneys lose their defense system. Now in the other video, like what is SS-31, I covered in depth how it works on that cardiolipin protein on the electron transport chain. And it binds to specifically cytochrome 1 and cytochrome 2, so you get this great, beautiful transmission of energy through that electron transport chain. When you have kidney damage, the kidneys are so influential because your adrenal glands sit right on top of them. So adrenal is adrenal. Another word for kidneys are renal glands. And so if you can get the kidneys functioning well, you'll start to see your adrenal glands will start to stabilize. Instead of having just high volumes of cortisol secretion all the time, having these stress hormones, excess levels of epinephrine and norepinephrine that lead to adrenal burnout, or aldosterone secretion that raises the blood pressure, what SS-31 will do is help calm down the mitochondria so that you can get rid of the mitochondria that are underperforming, and then it brings new workers into your kidneys. So you actually can start generating energy. You'll notice that urination gets better, your body has less inflammation, you have more energy, you don't have to urinate all night long because you've now fixed that energy transmission with SS-31. One of the other unique medical reviews that they did, this was phase 2 and 3 randomized controlled trial. And this was done, it was a multi-center trial for Barth syndrome. And this is a mitochondrial disorder caused by cardiolipin defects. And unfortunately, it impacts kids. And by the way, if you have, I'm part of this, I don't mean to pull us off, but I do want to mention that if you know of somebody who's got a baby in the neonatal unit and they need to be with their baby, but they have to work, I'm part of a nonprofit called 16 Days, and we can help them stay in the hospital with their baby, skin to skin time as much as possible. The babies get out of the hospital about 30% faster. So go to 16days.org and donate there, or help us out, or let us know if you have somebody in need. We'd love to help them. So, but Barth syndrome does impact, these young kids, and they don't thrive. So in this particular study, they were administering daily subcutaneous injections of SS-31, and they were measuring the exercise capacity, the cardiac function, the symptoms, and also looking at the mitochondrial biomarkers like MLCL and the CL ratios. And so what they found is that the daily dose of SS-31 improved the 6-minute walk exercise. They found that the cardiac stroke volume improved, symptoms of mitochondrial dysfunction based on the cardiolipin stability, that improved, validating it as a mitochondrial targeting peptide that binds to cardiolipin to repair the inner membrane structure, boost ATP, and reduce oxidative stress. So the way that translates to the kidneys, you've got massive quantities of mitochondrial density in your kidneys, and you need the energy to detoxify. The kidneys are one of the most important detoxification and filtration systems in your body. They regulate all the mineral balances, they regulate the stress hormones, And when the kidneys go out, that's when our blood pressure goes up. That's where we put more burden on our heart, our cardiovascular system, but it's also where we lose our vitality. So if you're looking to go deeper and find out more on SS-31, finding out if it may give you a little boost in your performance and health optimization, all you need to do is go to agelessfuture.com, click on the link, meet with one of our health ascension specialists, and they'll help you get the right labs ordered, get you with our medical team, and we can help you transform your health. I'm Regan Archibald. Appreciate being on the show. I'll see you on the next video.